Senior Doctor at Simon Fertility Center. I'm a gynecologist and obstetrician who's been focused on practicing fertility medicine for the last 15 odd years. I'm based out of a hospital in Cochin called as Saima Cochin Hospital. So today, I'll be speaking to you about one of the most commonly or most intriguing topics, that is the Polycystic Ovarian Syndrome. Now, what is PCOD or what is PCOS? This is a particular group of patients who have multiple conditions. They generally tend to have a lot of very small follicles inside the ovary, which does not grow to become a big follicle and later on ovulate. It does not happen. Plus, they have a lot of hormonal imbalance. There'll be a lot of androgen production, that is, the male hormone will be quite high in them, and because of that, they will have excessive hair growth all over the body, skin darkening in parts of the body, and because of the abnormal ovulation, they also tend to have menstrual disturbances. So, when you ask, as per the guideline of diagnosing a PCOD or a polycystic ovarian syndrome, they said that at least two of the three problems have to be there. Now, one is irregular cycles or completely abnormal cycles. Second is excessive hair growth. And third is an ultrasound picture showing a polycystic ovarian appearance. That is, the ovary having so many follicles. These three things are the main conditions where, so if two of the three are there, then that is how we'll diagnose them as polycystic ovarian syndrome. Now, because of these reasons and because of the actual awareness about this PCOD problem, I would say probably this is one of the most commonest misdiagnosed problems also. Today, I have a lot of patients who come to me directly and say that, okay, we have a PCOD patient, so we have Pcos, or we have uh, we have this syndrome. But a lot of times, probably it is not PCOD, because if you go, a lot of times when you get an ultrasound done, if you are a young person, you end up having a lot of good number of follicles in your ovary. So they will actually write the report as a polycystic ovary. And as a layman or as a common man, you end up reading it and then you kind of get worried, okay, you have PCOD. Then you go and start searching your net, and then realize that, okay, these are the symptoms: excessive hair growth. Now, again, what is an excessive hair growth? How do you define an excessive hair growth? And so, a lot of women do have a basic feeling that, okay, a little hair growth probably is an excessive hair growth. So they kind of club everything together and decide that they are a patient of PCOD, and hence assume that they are already patients, but not necessarily they are patients. Now, like I said, the early signs probably are these kind of menstrual irregularities, excessive hair growth, and things like that. Now, if you look at it, if you the second question that always arises is, what are the factors that increases the chance of PCOS? Probably one of the most important factors today that we feel is uh, the lifestyle. Unfortunately, I think probably the lifestyle that we are leading today, we are ending up seeing a lot more of PCOD patients than what we used to see earlier. See, a lot of times, if you look at even the treatment of a PCOD patient, the first treatment or the first option of treatment is actually lifestyle management. That is, getting your weight in control, reducing your weight. All those things will come together, and once the weight is reduced, the hormonal imbalance in your body will start getting better, and once it gets better, your PCOD symptoms also subside. A lot of people, while actually having a healthy lifestyle, even if they have PCOD, their other life parameters will be normal. So you really don't need to be worried about anything. You can still continue to follow. Now, again, when we look at, say, for example, when you say lifestyle management, we always talk about reducing weight. So uh, if you talk about the different management options that are available for PCOD, I think this is something that needs it's important for everybody to know, because this is a particular disease that needs treatment depending on what is the requirement of the patient. For example, is a patient whose requirement or whose worry is only hyperandrogenism, that is excessive hair growth, is her only concern. For example, a teenage girl or a unmarried girl, probably their concerns are probably either excessive hair growth or menstrual irregularity. So our focus of treatment basically should be to correct the menstrual irregularity, or probably looking at addressing the hair growth issues. So our treatment is basically focused on those issues. At the same time, in a patient who's got an infertility issue, who has an anovulatory problem or ovulatory disturbance, which is one of the most commonest problem that we see today, at that point of time, we always end up treating the ovulation problem. We try and correct the ovulation, give medicines. We generally end up giving the medicines to produce the follicles, create more number of eggs. So these are the basic things that we correct. So in a normal person, if the irregularity of menstrual is what is a concern, then we treat them accordingly. If in an infertile patient, we treat them in a different way. For example, because my main field is infertile, so I would say generally how we kind of take them through a different process of treatment. First, obviously, is if there's a patient, we have a lot of time, she's obese and all those things. The first line of treatment will be always be lifestyle management, reducing weight, exercise, uh, controlling your diet, and all those things will become your first line of management. And if those don't work out, is when we start with these kind of oral medications, which are in the form of supplements. We give in these are group of patients where we end up giving a lot of supplements, like even medications like metformin. These are anti-diabetic drugs, because these are women who have a high insulin levels in their body. So those are corrected, reduced by these drugs. Obviously, then your hormone levels get corrected, your ovulation gets corrected. So we give those kind of medicines. Line of drugs that are available are drugs to produce ovulation, because in these patients, either the ovulation is not happening correctly, it is either happening delayed, or it is not happening at all. So depending upon all those scenarios, we'll have to take the treatment accordingly. So I have a question here, is that the patient suffering from PCOS and I should conceive, how can I go about it? What care should I do? So when you try to conceive, the first thing that you ask yourself is that, yes, you have PCOS, agree, but how is your menstrual cycle? If your menstruation are regular, then half your worry is lost, because the problem always comes with PCOD is when you're having irregular menstrual cycles. If it is a regular menstrual cycle, means your ovulation is happening correctly, so you have regular sexual life that is corrected. So it would not be a big difficulty in getting pregnant. The challenge always comes when you have cycle. When your irregular menstrual cycles, like I said earlier, the ovulation might happen much later than usual, or it might happen in certain people who don't get periods for 2 to 3 months. Probably in those group of patients, we might not have ovulation. For example, somebody is there who gets a periods at, say, 40 days, 45 days. Their ovulation might be happening, but instead of the conventional time, that is, say, 13, 14 days of menstrual cycle where you expect the ovulation to happen, their ovulation might be happening on the 25th day, 30th day, 31st day. So one of the first treatment strategies in these group of patients is actually telling them to have a regular sexual life. As you know that if you need to conceive, you have to have sex. The sperm has to reach the uterus at the time of ovulation. And in this PCOD patients, we don't know what is the time of ovulation. So when you have regular sexual life, when I say that regular sexual life does not mean that you have to have sex every day. It only means that every 2 or 3 days, once you have sex, the sperm has a capacity to live inside a normal female for 2 to 3 days, whereas the egg has the capacity to live for a day. So when you have at least regular sexual life every 2 or 3 days, there is always the presence of sperm and inside the female body. So whenever the ovulation happens, there's a possibility of them to get pregnant. So that is why you end up seeing a lot of patients with very bad known PCOD patients. they don't find it difficult at all to get pregnant because they have regular sexual life. So because they are having regular sexual life, very easily they get pregnant. Now, that is one of the first things. And then the next line of treatment is to give you medications. Like I had said, there are tablets as we give, there are injectable medications that we give. These are different medications that we give. Then the second thing is that how do we correct it? Is there any, now a lot of, even after the injections are also not working, then the next option is to see if we can do some kind of, there are surgeries that are available. There is something called as laparoscopic ovarian drilling. These are surgeries, but as kept as a last option to treat PCOD patients. But this has to be done only in a very selected group of patients, and not in patients who have otherwise no other issues. So we have these patients has to be selected very properly. And the last option in infertility patients is to take them or make them do an IVF when there are so many coexisting factors that is causing infertility, or in patients who are have very bad or anovulation even after injections or medicines and things like that. So one thing that you should always understand, that you cannot completely treat PCOD. You cannot treat it and correct it. You can control it. That is the only thing that with PCOD we can do. So as long as we are taking medicines, during the taking of medicines, the PCOD can be controlled. But once you stop the ovaries again, it's just ovary there. So it will come back and do the same problems that it was creating. So there is nothing that can be done. The only change that can happen is over the years, as your age increases, obviously your ovarian function will reduce. And as the ovarian function reduces, these are patients who are having excessive ovarian function, too much ovarian function. So in these patients, as gradually as their age increases, the ovarian function reduces, so the severity of the PCOD also reduces. So that is probably something that can happen. But otherwise, PCOD is a disease that cannot be completely cured. It is only a disease that can be controlled in a particular time, as long as we are doing a treatment. For example, when you're saying that, when I'm saying a lifestyle management, as long as the lifestyle management is happening correctly, you're not putting on excess weight, your PCOD also symptoms are also not coming out. The minute that gets disturbed, you start putting on weight, your hormone levels go imbalance, and your PCOD symptoms will start coming out. The ovary always still remains to have PCOD. So because of all the hormonal imbalance, that needs to be kept under control. Whenever we are keeping it under control, the treatment is on. That is one common question that we always ask. Let me look at the other questions. So so I think I've tried to try to address most of the questions that has been put forward to me by the panel. But like I said again, PCOD is a disease that requires treatment specifically depending on the problem or what their complaint is. Everybody might, you can have PCOD from your young age group to the time, to even older people also, before they attain their menopause, also might have abnormalities in the abnormalities in the menses because of the PCOD issue. So you always end up addressing water issue. Hello doctor, how is PCOD decided after delivery? See, now again, a lot of it's immediately post delivery, because you are breastfeeding. Okay, because you're breastfeeding, the possibility of you to have irregular cycles are always there. So you always end up assuming that you are having some kind of PCOD. You need not. So you have to give it right. As long as you are having breastfeeding, there is a prolactin hormone is high. There is always an issue, or probably there might not be ovulation because of this hormone, or over the months it can become abnormal because of the hormone. So we should always differentiate whether it is a irregular cycle because of the PCOD itself, or because of the breastfeeding itself. Second thing is that, see, a lot of people who are initially normal probably end up putting up a lot of weight. So these are patients who probably had some elements of PCOD inside them, but because they put on weight post pregnancy, post this thing, their symptoms will start coming out more during delivery time. So probably those group of patients are the best whom we can have some lifestyle management, and things can get corrected even after delivery. So that is why in these group of patients, probably you might end up realizing that they're PCOD patients after delivery. Are IVF and PCOS together? See, these PCOS is treated. I hope I'm still alive. Yes. So when you look at IVF, like I said, is the last resort of treatment. Now in PCOS, what is happening? The ovulation is not happening. In IVF, what we do, we stimulate, produce eggs, take the eggs out, get the sperm, fuse them, make it into an embryo, and then transfer it. So the problems associated with PCOS is generally overcome, along with even of so many other problems also there. So that is why IVF as a process is primarily done as a last resort of treatment when there are multiple problems or the PCOD treatment is not getting treated with the initial management. By doing an IVF, you don't treat the PCOS. You're only treating them to increase your possibility of getting pregnant. Even after getting pregnant also, their PCOS pattern of the ovary, everything will be the same. That is not going to change. So I hope I'm clear and I've been able to kind of give you some guidance as to what is the basic information that you need to understand regarding PCOS. As long as there is no message, I think, like I said, um, uh, you know, hello, can you hear me? Yeah. So thank you once again. Um, Take home messages, always get treated for the problem that you're actually having. Don't just go back and start taking hormonal medication PCOD. Understand what your problem is, specifically diagnose the PCOD, and only treat it when you require treatment. I think that is very important. So thank you so much. It's again Dr. Parasuram Gopinath here, signing off, Senior Consultant Director for Sign Off Fertility Center, Kochi.